I'm Mr. Snapper.
And I'm Red Snapper.
And this is Project Nutmeg.
Okay.
Today, we're going to talk about pet health decisions. Okay, you're a pet. Are you ready to make all your health decisions?
She's going to make the decision to crawl down from our laps into a bed.
It's the thing about dogs. No matter how smart they are, they can't make their own health decisions.
It's true.
If you leave it up to dogs, all they would do is just eat anything they see and run around like maniacs.
Oh, and poop a lot.
And poop.
Lots of pooping.
Lots of pooping. When we bring a pet into our family, we look at that as a lifelong commitment to the care of that individual pet, to that individual animal. There are a lot of pet health decisions to make over the years, and we're going to touch on just a few.
Just a few. We will talk about preventative measures, treatment concerns, and quality of life. As we keep saying, we are not vets.
We are not vets.
All of this is experiential knowledge, and your mileage may vary. So please keep that in mind. We're just hitting on major things that come up over the course of a life.
Yep. And we're big fans of veterinarians. So find one, get one. They're great. Preventative measures are the things that you do to give your pet the best chance of survival in a domesticated life. And these include such things as vaccinations, regular vet checkups, parasite control, dental checkups and cleanings, and healthy diet and exercise.
I want to say that taking your dog to the vet regularly helps them monitor the quality of life over years.
Yeah.
So Buster, with all of his lumps and bumps, our vet, Dr. Trent, we sing Dr. Trent's praises. Our vet knows what his life has been. He hasn't known him his entire life, but he's known him for a few years. So he knows every year when we do the dental, we take off the lumps and bumps, we check him out, we make sure he's good. He keeps an eye on all of his vision. Taking your dog to the vet for at least an annual checkup is huge. And the vaccinations are important, especially if you send your dog out for boarding or for daycare. Dental is important. It gives insight into what's happening in the dog's mouth. And I like to think that we got many more years out of Buster than we would have because of the regular dental care. It's true. Which helped us discover
The growth. All of that. And yeah, for sure. It's like this sort of the ideal of the family doctor, right? And gosh, wouldn't it be great if it worked out like this all the time for people, that you have this physician that you see on a regular basis who recognizes things and sees, last year you didn't have this going on, this year you do. Maybe there's something there we need to run a test or look at. So it's the familiarity is very important, and it's sorely lacking across the healthcare system anyway, which is unfortunate, but it's a situation that you can create for your pet with regular vet checkups.
It's true, and there are some physicians that do remember and keep great notes from year to year. There's one that I see every year who is phenomenal about understanding my concerns and monitoring things, so that as there are changes, she will note, oh, so this is different from last year, and we're gonna look further into this.
And that's great that you have that. What I'm saying is that not everyone has that.
It's true, and not every provider for humans does that.
Yeah. If you can find a doctor who has that kind of concern for you as an individual, do what you can to hold on to them.
Hold on to them.
But it's so difficult because our system is so messed up.
It is.
Anyway.
It is. Treatment concerns occur when life throws you a curveball and you have to choose the best course of action. It's important to do your research and ask all of the questions so you can make the best decision with the information you have available at the time. First, research your options. That means check the internet. That means ask other people who've been through the same thing. That means you should watch YouTube videos to find out more about something. take all of the questions, look into herbs or different things, whatever you can do to help your pet. Research everything about that condition so that you really understand it. Then, number 2, follow your vet's advice, but ask too many questions if you have them. And honestly, there aren't too many questions. Jot those suckers down. When they get on the horn with you, you say, okay, let me ask about this, let me ask about that. Or if it's an in-person appointment, ask.
Yep.
Ask all of the questions. Can we try this? Can we try that? Have you heard about this new thing? Have you heard about that? It's absolutely worth it, and it may be annoying for somebody to, like, oh my goodness, you're hammering me with questions, but it's far better to ask them.
Well, yeah, and I like how you put that about too many questions, because I think particularly for younger folks, sometimes you get concerned about, like, oh, am I asking too many questions? No. You're not.
No.
Particularly if you're paying for a service. And listen, we talk about developing a relationship with a veterinarian, but still, that's a service that you're paying for, and you want to make sure that you come away from that experience feeling good about it, feeling like all of your questions were answered, and that you're not going away like, I just don't understand this thing that the doctor kept saying. Ask them to explain it to you like you're a 3-year-old. Don't be afraid to look foolish. I think that's another thing I see sometimes, is that sometimes younger people are afraid of looking foolish. It's like, listen, we're all foolish. There are all things that we don't know.
We're all foolish.
We all are. There are things that we don't know, and the only way you're ever going to find out about something is to ask those questions and go looking. So yeah, too many questions. Ask too many questions, but at the same time, you have to be willing to hear the answers.
Yes, and you are going to an expert. You're going to a vet because you don't know how to do it yourself.
Exactly.
Ask them.
And we're like pretty big DIYers, and we joke about, like, maybe we should just go to school and get our vet license,
right?
Because we like to know things. We like to know how to do things ourselves. Mm-hmm. But it's that sort of like being humble and recognizing there are people who have dedicated their lives to a certain path. They do care about what they're doing. They care about the animals they're treating.
They really do.
They're the experts, and it's good to listen to what they have to say.
Yes, and they get the continuing education. They know about the continuing education, so they are up to date. There may be things that develop here and there that they learn about as they cross their plate, but they know stuff that you probably don't know, and they can explain it to you like you are a 3-year-old or a 5-year-old, and it's okay to say, hold up, I don't know what that means. Mm-hmm. That's fine. And they'll explain it to you. I'm sure they would rather have people who are interested and partners in their pet's health care than say, okay.
You have to figure vets see people who neglect their pets all the time. So they probably, if you're a veterinarian and you're watching this, let us know in the comments below. You probably much prefer it when people are engaged in their pet's health. I'm guessing that's something that you prefer over someone who is just, they bring you the pet way too late.
Say, here, fix it.
Fix this.
Yeah.
You let us know in the comments below if you're a vet. Are we totally off base here?
Are we? Okay, number 3, watch for adverse reactions or no response to treatment. Now, I want to talk on this a little bit because Buster was on a pest preventative, an oral pest preventative that was supposed to help with fleas. Mm-hmm. Coca was on it as well. We noticed that Buster started getting noodly legs, and this was a couple years ago. So he wasn't as old as he is now. His vision was a little better, but he had noodly legs.
He would walk like he was drunk, basically.
Yes.
But just his hind legs.
And it was disturbing and upsetting, and what's happening for him. And we had to research it, and we talked with the vet. It wasn't Dr. Trent, but we talked with the vet, and the vet said maybe there is this neurological condition. We had genetic testing done already, and it was like, well, he's not prone to this.
He's not prone to that. I mean, things can still develop.
Things can develop, but it's not the first thing on the list. So we did our research.
Right. Well,
and we noticed that there was something different about him, and then it would go away, and then we'd
give him the pill again.
And then within a month
it would develop again. So it's correlation, right? So maybe it has something to do with the pill, and so you dig into that and you look at the adverse reactions, and neuropathy was one of the possible adverse reactions to the pill. So, and this is, so like we said, you have to listen to the expert and pay attention to what the vet says.
Yes.
But keep asking questions and do your own research as well. And sort of, you have to weigh the information that you receive. And in our case, there were other, I think it was breed specific as well. I think there are specific breeds that it had that effect on the neuropathy, and it included poodles. And if you've watched the earlier videos, you know that Buster is like a quarter miniature poodle. So everything lined up, it just kind of made sense. And we did actually ask the vet, like, is this a possibility? They said, you know, it is a very rare thing that can happen. But it is possible. So we didn't just, you know, unilaterally decide to take him off the pills. We did actually do it in consultation with the vet.
We did, and point number 5 here is keep asking your vet questions, which we do. We absolutely ask questions. This one has a genetic variant where she can't have certain medications, and our vet knows that from the genetic testing, but we mention it every time, and we ask lots of questions to make sure that everybody gets the best care that they can, because we are trying to last, all of us are trying to last as long as we can.
Yeah. And I just, on that point as well, we're talking about like developing that relationship with the vet where they follow your pet and they track the changes over time, and that's important, that's good, and the vets that we've had and that we currently have do that. But we're also always careful to remind people that when we bring the dog in, it's like, just a reminder, she has this little genetic thing, she's not supposed to take these kinds of medications. The vet's really good about asking, like, have they had any adverse reactions to medications? It's like, it should be in the file by now. But for instance, Bus has a reaction to Galliprant, I think.
Yes, he gets diarrhea.
Yeah.
So we always remind them, don't give him the one that gives him diarrhea. Yeah. There's he's on gabapentin for pain. That's what he can have.
Don't take it for granted that they know, because they're busy. They see a lot of pets as well. And honestly, you are your pet's best health advocate. Just like you really are your best health advocate for your own health. You are the best advocate for your pet's health, because you're the one who sees them all. You're the one who cleans up their poop. So you're in a better position to care about them.
It's true. It's absolutely true.
Quality of life is the last phase of pet health decisions. We have such a short window of time with our pet friends that we want to make it the best time possible. And some of this may sound familiar, well, at least the first one. The first, like, real concern with quality of life, regular vet checkups. So again, just like if you have that relationship with the vet and they see the changes over time, vets are also way more keyed into symptoms that you may not notice. How to put this in a way that isn't really depressing? Vets have seen a lot of animals complete their time on this earth.
They've seen the entire life cycle.
Yep. They are familiar with the signs and the symptoms that we just aren't necessarily, because we don't see the same volume of pets.
We also have the emotional attachment,
sure,
and that can cloud our perception of things. The love is so strong, and we want to continue to make the memories forever with our pets. That's just not the way it works.
That's right. I was going to say this earlier about asking questions. Sometimes we're like Schrodinger's pet owner. We feel like if we don't ask the questions, our pet will just be healthy for the, if we don't know that it's cancer, it's not cancer, that sort of thing, which is ridiculous. The difference between being an adult and being a child is something that I've said this before, is when you're a kid, no one tells you anything, you don't know anything. When you're an adult, it's all about, you're the one who has to find out. You're the one who has to fill in that void and discover what you don't know. And being a responsible pet parent is about that. And when your pet's getting older, like Buster's 13 now, as they get older, it's important to sort of stay on top of things that might pop up. You never know. Buster's had a ton of different growths, tumors basically, non-cancerous so far.
On the skin, in his mouth.
So that's something that, we're not doctors, but we need to keep on top of it and make sure that there's not something. We just want to make sure that if he develops actual cancer at some point, a vet is most likely the one who's going to find that. And if you catch these things early, you can treat them, things like that. So regular vet checkups as they get older. You might think, my dog's he's 13, he doesn't need to go. I'm not going to bother with the vet anymore. It's like, no, keep bringing him in for the regular vet checkups. And that's just it's a quality of life point.
It is. Let the vet kick the tires. Make sure that, even though you're putting a lot of miles on your dog, let the vet check them over and see if there's anything that you need to be aware of.
Yeah. Another point for quality of life is providing for them a comfortable environment. And maybe we go a little overboard on this one. Maybe we're a little ridiculous with it, but we make sure that Buster, in particular Buster, because he's the old man in the house. At least in dog years, he's older than me. We make sure that he has plenty of soft places to crash. He sleeps a lot these days. We want to make sure that he's comfortable when he's snoozing. If he's having a rough time, like lately, something's been acting up in one of his hind legs, and he's had sort of a hard time getting down the stairs to go outside, we just carry him down the stairs.
We have a strap too.
We have a strap.
We got a strap when he had noodly legs.
Yeah, when he had the neuropathy thing.
In case we need that extra support to get him up and down, or if we need to carry him.
Right.
And you said when he crashes.
Oh,
so
to be
when
clear.
we mean when he gets tired, he sleeps. He has a kitchen bed now.
He has a kitchen bed now. It's just sort of permanently in the kitchen.
We put it in there after his surgery for his lumps and bumps, and he's so tired that he'll just sleep in it. As far as actual crashing goes, when we moved into our house with the hardwood floors, he slipped early on, and he was 11, almost 11 at the time. So we got floor runners that grip, and we got rug grippies that catch on the floor, and we also have a few utility rugs in different places.
A hodgepodge of rugs throughout the house now.
It's like going to a concert where it's like John Mayer in the very beginning. He would have all of these rugs on the stage.
Dead in the
Yeah, so we have rugs everywhere that don't slip, and we try to put them in places like the baby gates, by the baby gate, because he still raises up to see us when we get home. So we put them there so he doesn't fall and hurt himself. It's very possible for him to fall and hurt himself. So we do everything we can to make sure the environment's comfortable, make sure he has proper lighting so that he can see well if we step out. And yeah, we want him to enjoy his time, his retirement.
Yes, we do. And going along with that, sort of a third point, which is pain management. So for us, we have a headache or whatever, you can grab an aspirin or a ibuprofen or whatever. You have to watch your dog, see if they're doing okay, or are they in a little bit of pain or whatever. Buster has arthritis from time to time that makes it difficult for him to get around a little bit, just a little bit. But we basically have a regular prescription of gabapentin that we can give him something for pain as needed. And
the arthritis is stronger in one of his front paws. I think it may have developed earlier in life.
He was attacked when he was a tiny puppy by a cat, we think, and before we got him, and he has his paws a little bit.
He's a little pigeon-toed.
A little bit.
But he's got pain management. He gets a gabapentin a day unless he has surgery or really needs a second one.
The important thing is they can't take the same pain medicines that we take.
No, they can't. And you need to talk to your vet about pain management.
And dosage.
And dosage. If your dog gets cranky, doesn't want to be touched somewhere that they should want to be touched,
or at least shouldn't mind it.
Right.
It's not like, oh yeah, touch me right there, please. Oh yeah, right there.
Like Coca will let me touch her feet when she's sleeping unless her foot hurts. She won't let me trim her nails. And she doesn't like to have her feet touched, even though as a puppy we did the whole touch the feet in her class to make sure she was fine with it.
Like I'm looking at your ears. I'm poking around your nose.
I'm poking. But she doesn't.
Nutmeg just doesn't care.
She doesn't like it, but if I touch her feet when she's asleep or she's very relaxed and I don't have anything in my hands, I'm just, it's just my hands and her feet, she doesn't get upset unless her foot is hurt. And then that's a reason to go see Dr. Trent and say, hey, Coca's fussy when I touch her foot. And this is the foot. It's the passenger side, front, or driver's side rear foot.
That's right. The fourth point, and this kind of goes along with what Red was saying about comfortable environment, is adaptation for mobility. So, like we said, but recently Buster's been having an issue with one of his hind feet, we think. We're not sure exactly what happened. Maybe he sprained it somehow, we're not sure. But you have to make their mobility a priority. So if they have a hard time getting around, find ways to help them get around. There will come a point where Buster, who loves to go on walks, hasn't really been able to recently because of the foot, we'll probably throw him in Nutmeg's puppy stroller and walk him around the block just because we know he likes to get out. Carrying him up and down the stairs, the back stairs, so that he can go, do his business.
And helping him we have soft stairs to our bed and to the couch. And we got the stairs a few years ago because
he started struggling. Because, dogs like to hop up and hop down, sure. But he started struggling with the hopping. So we got some stairs, little soft, cushiony stairs that he could go up and down.
Mm-hmm. One of the challenges here, though, is that the stairs are soft. They should be, nice on dogs who have arthritis. But when you've got mobility problems and you're trying to use something that isn't supporting you very well to push you up, you just kind of sink into it and then he just falls back on his butt like Bambi trying to ice skate. So we do have the stairs and we will help him. We'll put our hands under his chest when he's trying to get up and down those stairs, or we'll lift him and support him and give him whatever he needs so that he can continue to move the way he's able to move. But we did get a puppy stroller for Nutmeg, so it's easier to manage her when we go places with her. And I made sure it was big enough that it could support his weight, because he loves being outside and he loves going on walks and seeing the neighborhood. But he may not be able to make as long a walk, or may not, have the mobility for that. And I still want him to enjoy the time that we have.
Yeah, absolutely. And which goes to the last point, which is emotional well-being. Very important. Give the dog lots of love. When they're a cute little puppy like this, it's easy to just be all smooches and pets and like, oh, just baby. But older dogs need that too. They need all that affection. They're so social, and they grow to really love the people who take care of them, and
they do.
They need that love back. Lots of treats. Emotional well-being also includes things like, Red has mentioned before that when it's training time for Nutmeg, that Buster likes to join in. And he can't do a bunch of tricks. Right now his whole thing is, whenever you're doing the thing where
the weaving between the legs,
weaves between your legs, Buster will just start turning around in a circle. He's contributing.
He's working.
He's working.
He knows it's training, and we get treats when we do something.
He gets treats and he gets praise.
He does.
Because that's what he needs.
Yes, lots of good boy. Coca's not in the room with us, but Coca also joins for training now, and she'll sit for a lot of it because she's got the perfect sit-stay. She'll sit.
Perfect sit-stay.
And she's very plump, but she also has been having some mobility challenges with one of her legs. I think she gets stiff. She's 9, and she's 9, and she's a bigger dog.
Yeah.
So she works for treats too, and everybody gets an attaboy, attagirl, because they're doing a great job. So give them praise, give them love, let them sleep beside you, or if they want to lean on you and drool on your leg when you're on the couch, let them.
Yeah.
Let them.
And I mean, and as they get older, they start to revert to their puppy state when it goes to potty training a little bit. Don't yell at your dog.
Don't punish them. Set them up for success.
Yeah.
Get pee blankets. Get pee pads to put on top of the pee blankets for when they don't hear the crinkle, but they've got to go and they miss. Just set your house up so that you're okay to support them.
Yep.
Eventually, we all lose a little bladder control, right?
Eventually. It happens.
You may have to make a tough decision based on your pet's health. Quality of life is your North Star, so always pay attention to that. It is very tough to think about disconnecting the future and no longer being able to make memories with your pet because you have such a strong attachment to them. But pay attention to quality of life. That's what will guide you. And don't regret the decisions that you made, because you made the best possible decision you could with the information you had available. If you do feel like you should have made a different decision, take that learning into the future. And it will help guide you because you'll have more information. And be kind to yourself.
Absolutely. Could not have said it better myself. Well, I guess that's it for this installment of pet advice from non-vets.
From middle-aged entertainers.
From middle-aged entertainers. Yep. What do you think, Nutmeg? Do you have anything to add to any of this? She made little grunty sounds. I don't know if that means anything to any of you. Let us know in the comments below. What do you think her little grunty sounds mean?
Please be sure to like and subscribe. Yep. Share us with a friend if you know somebody who's facing a decision, if this can help them, or if anything on our channel can help them. Please share us.
If you're a vet, please let us know in the comments below if we're completely off base. Love to hear it.
Yes. And if you don't want people to ask you questions, because they still will, but we'd love to hear it from you. Do you hate it? Does it make you crazy?
Stop asking questions.
Exactly. And if you do have questions and you're not sure how to ask them, throw those in the comments too, and we'll try, since we do words.
Yeah, that's true. We do words.
We will guide you on how to ask a question if that's a big problem for you. It's fine.
So
We're happy to help.
Like, subscribe, boop the bell for notifications. I understand that's important as well.
I guess so.
I don't know how any of this works clearly. And see us next time.
See us next time.
Bye.
Bye. Oh, this baby.
Snoozy baby. Her little whiskers get trimmed when they do the little trimming, and you can see her little whiskers in there.
Yeah.